Hey, Dr. Lindsey here with Wendy. We just had a guy come in that had had 3 surgeries elsewhere. And he didn't have a bad result, but he needs a little bit more hair. And so now it's, how do you get hair out of this dude's head? And the problem with this guy, and the problem with a lot of guys, is that when they go to these places, sometimes the doctor that's working on them will do a perfectly fine strip on case number 1. And then they'll go back to the same guy, or potentially a different guy, and that second case, they'll do a perfectly fine strip, but not anywhere near the first scar. And then they'll go get a third strip, which is also perfectly fine, but it might cross both of the previous ones. So now you get this railroad tracks, looks like Grand Central Station going across the back of some guy's head. And how am I supposed to get any hair out of the back of his head? And so I just cannot figure that out. I've been doing this 21 years and 50 days now, and I cannot figure that out. But it becomes a real problem. If you have one star on the back of your head and it's in the right spot, meaning across the bump that we all have on the back of our heads, it's not too wide, and you wind up with anybody's average scar. Fortunately, our average scar on a virgin head's like this. Even if you have a little wider scar, you can always come back and either sew up to that or cut it out and get a decent amount of hair. For more topics on this, search my name in the keywords double-edged sword, where I go into the kind of the struggle between getting more hair and getting a good scar. But as long as you stick with one scar, things can only get so bad. I just cannot figure out why you would do a second scar close to the first scar and leave some good hair in between, because then you'll never get those hairs out. And then even worse, why do you do a second scar or a third scar and cross these things? So we were talking about this, and Wendy said she knew why. So why?
So what I figured was that when they go on the patient goes on a consultation, does the first procedure, and the doctor says we'll do 1 scar. Right? And they hope to get it very, very thin, like that.
Yep.
Let's say they get it like that.
Talk to the camera.
Oh, let's say they get it like that. They get a thin one. Then they go for a second procedure, and then they want to get more hair, and then they get more hair, so they decide not to cut out the first scar, but do a second scar on the bottom and leave. And they probably tell the patient, and then you're gonna leave some hair in between, and you can comb it down. It'll be able to hide. But the second scar, because you already removed one chunk, is gonna be wide like this.
And most of these guys are not doing a 2 or 3 layer trichophytic closure. And even if you are, like we do, you can't always be sure you're going to get a perfect scar. You got to kind of plan for a medium scar or even a poor scar on the second, third, or fourth, or fifth case in, and hope for the best.
So then that's a second scar, and then they go for a third procedure
with the same guy.
With the same guy.
Or a different guy.
Or a different one, and then there's the whoever doesn't want to cut on the first one because there's not much hair. On the second one, even worse because it's a wider scar. Right?
Right.
So they go in and they do a cross one?
It just doesn't make sense. So anyhow, we don't have any great summary of knowledge to pass to you guys, but if you're going for your first case or your 12th case, just do a little research and make sure that you and your doctor talk about the pros and cons of where to put the first scar and any subsequent scars.
Yeah, because we do have pictures of people that had come here with 1 scar, another scar, and a third scar, and it looks like steps, and they're wide.
And then unlike the guy that was just in here, what am I supposed to do to get a little more hair out of his head? His scalp is so tight, it's like a rubber band. And so I'm sending him home to stretch for 6 weeks and then come back. But if he's looser, maybe we can get 800 grafts out of him and sew up to the best of his scars. If he's not any better, then we're stuck with FUE, but he's got a head full of scar now. And I'm not sure we're getting a whole lot of hair out with FUE because it's a head full of scar. And then if we do, his wife was intelligent enough to say, well, won't that deplete the donor area so that now you can see those 3 scars? And I said, bingo, lady, you're exactly right. And then the third choice would be modified FUE, which would be fine. I think you can get away with that better on these tight scalps. But still, it's going to be, you know, a challenge to get good modified FUE punches out of a tight scar-filled head.
So bottom line is,
Do your
just
research.
Do your research. If the doctor wants to do a second incision instead of cutting it out, question it.
Yeah, talk
and
about
ask and talk about it, and then research it and see what would be the best thing to do.
Last thing, because we had a guy just posted his video this morning that had had 2 previous strip cases, not too far from here, that were both in a crappy location, and he got a crappy scar.
Back here.
The camera can't see.
The camera can't see right there.
So down real low, and you know we talked. Me and the patient and I talked about it. Do you do a second scar if we're in the good spot, where he'll probably get a good scar and we'll get good hair, which is choice 1. Choice 2 is cut out the crappy scar, but he's still going to get a crappy scar and there's not much hair down there. Or do you just sew up to it? And we together debated this a couple times and decided to sew up to his scar. So there's room for compromise and talking. So talk to your doctor, make sure that you and he both understand and make the choice that works best for her. Good luck.